Good evening. Welcome to the Recovery Channel. I'm Dr. Richard Whitney, Medical Director of Addiction Services at Shepherd Hill in Newark, Ohio. I want to talk about a medication called buprenorphine. It's best known under its brand name Suboxone. People on the street say Subs. And I'd like to get some medical information out there to dispel any misinformation about how this medication works, what it should be prescribed for, and the desirable effects that it produces on people with this terrible, terrible disease of heroin and other opiate addiction. Now, this medication was approved by the Food and Drug Administration in 2002 under the DATA Act, Drug Addiction Treatment Act of 2000, for office-based or hospital-based prescription. Now, what does all that mean? What that means is the Harrison Act of 1918 made it illegal for doctors to prescribe opiate-based medication like codeine, like heroin, like morphine, in order to treat opiate addiction. This is not a new idea. People in the late 18th and early 19th century said, well, maybe if we prescribe therapeutic doses of opiates, then that will stop people from killing themselves from overdoses and shooting drugs. That was started, and the reason it didn't work well is because very little was understood about the disease of addiction, and the range of medications was so limited at that time. So prescribing opiates to an opiate addict was made illegal. The first opiate that got through that was methadone, and doctors had to prescribe, after special training, for what's called a waiver, which means this law is waived and they can legally prescribe opiates. So that's why it's called obtaining a waiver from the Drug Enforcement Agency through another government organization called SAMHSA, Substance Abuse and Mental Health Services Administration. And there's a website up here for you to gather more information about this. So in order to do this, doctors have to obtain this waiver to either detoxify patients from heroin and other drugs, or to maintain them over the long term beyond the hospital detoxification phase, and get this number from the Center for Substance Abuse Treatment and Drug Enforcement Agency. Now, at minimum, doctors can get this waiver simply after taking an 8-hour course. This could be a live course or it could be an online course that educates doctors about the minimum amount of information necessary to safely prescribe this medication. And then many people know that doctors have a long string of letters and numbers, a DEA number saying you can prescribe drugs like Percocet and morphine and Vicodin and cough syrup containing hydrocodone. But you get a second number starting with an X if you have completed this course and can prescribe buprenorphine for opiate addiction. Now, some of the information we need to know to speak intelligently about this is the difference between a full agonist, a partial agonist, and an antagonist. Now, we're talking about this little U-shaped dip is a representation of a receptor in the brain tissue on a microscopic level that is set up to receive a molecule of our own morphine that we produce, endorphins and enkephalins, or an exogenous or swallowed or ingested opiate like morphine, like heroin, like codeine. And if that's a full agonist, it means it fits perfectly into this receptor in the brain and turns it on. Oh, I get a good feeling, pain relief, I get a feeling of relaxation, I get sleepy, and the full what's called agonist action. A partial agonist is like this medicine we're going to talk about, buprenorphine, where it kind of weakly turns it on, doesn't completely turn it on all the way, but does have some effects like opiates as far as some mild drowsiness and some mild pain relief, but not the whole morphine-like effect. And the other that we talked about in a different segment is called an antagonist, which is naltrexone, which blockades that opiate receptor and prevents any morphine-like drugs from getting into this receptor in the brain. Okay, so let's look at a little video here on how these partial agonists work, like buprenorphine. What happens there, these are the little receptors on the outside of a brain cell, these little bumps that you can see here, let me stop the video, all through the middle of the screen are molecules that are the bag or the membrane around. This partial agonist, again, in this video it's completely white. This is a buprenorphine molecule, for example, is blockading the opiate receptor from this green-looking molecule, and let's say that's a molecule of heroin that wants to get into the receptor, but this partial agonist is blockading the green heroin molecule from hitting the opiate receptor in the brain cell. Now, what will happen here as soon as the video gets started again is this white molecule of buprenorphine does not produce euphoria, does not produce complete pain relief, but only mild effects. But it completely holds on to this receptor so tightly that heroin and morphine and other molecules like that cannot turn it on. So you have these little electrical stimulations which are very, very, very mild from the buprenorphine. We don't get the full effect from these green molecules of heroin. And over a period of time, this dopamine release, which makes the euphoric effect of opiates, has a very mild release, but not a dramatic release. So again, that's a picture of how it works in a cartoon of the brain. The properties of buprenorphine that make it valuable means it's high affinity, which means it holds on to that brain receptor very, very, very tightly. It is a partial mu agonist, and mu just means the type of opiate receptor, okay, that is being stimulated, and a weak kappa antagonist, which is another type of opiate receptor. The turn-on effects or agon effects plateau, which means that it levels off, it doesn't produce breathing cessation and pain relief like other opiates do, like heroin and morphine. So it's a much safer medication in adults. It can still kill children, so we need to always make sure this medicine is kept out of small children's hands, but it's almost impossible to overdose on buprenorphine because it won't stop people from breathing. Now, this medication, Suboxone, was initially produced in a 4-to-1 ratio with another molecule that we'll talk about. 2 milligrams, 4 milligrams, 8 milligrams, and 12 milligrams. So we have a variety of different sizes to dose the medicine just perfectly for a given individual. But because buprenorphine is still an opiate, and if you take enough of it, you can still get high on it, in order to deter opiate addicts from cooking down a Suboxone and shooting it up, they added a molecule called naloxone. This is chemically similar to, but separate and distinct from naltrexone, because naloxone only works if it's injected. This is the life-saving drug that people in a heroin overdose get immediately injected, and they wake up and the overdose is overcome. So it's a life-saving drug. But if you take a Suboxone tablet or film, cook it down in a spoon and inject it, the naloxone will put people into instant withdrawal. That's why Suboxone cannot be misused or abused and people don't get high on it. The brand name Subutex was the actual buprenorphine all by itself, which was rarely used, and in fact, the drug company Burkitt-Reinkeeser does not make Subutex at all anymore. Okay. Now, what did we do with this molecule? Well, when it first came out, this medicine, buprenorphine, was used to get people off of heroin, methadone, morphine, Percocet that was being used in addictive amounts, so people didn't suffer through the horrible withdrawals. And then what happened, and again you can see this original formulation of the Suboxone in this hexagonal type tablet with an 8 on it, showing it had 8 milligrams on it. It was placed under the tongue, not swallowed because the stomach acid will destroy it, absorbed into the bloodstream to do its job. This is the Subutex, 8 milligram and 2 milligram, without the anti-high drug called naloxone in it, because if you took the Subutex, you could cook it down in a spoon and inject it, and that's what the OWN in Suboxone prevents from happening. Now, those tablets were pretty good, but people didn't like the taste, and it took a long time to absorb. So the drug company came out with a film like this. It's kind of like breast strips. It tastes better, it's absorbed more completely, and goes into the bloodstream more efficiently, and people don't end up swallowing some of the pills. And this is about the size of a quarter. and again, it's taken under the tongue, or what's called sublingually, in order to be absorbed into the bloodstream. Now, because the patent has run out, there are generic manufacturers of this medication, and this is a picture of a generic form of buprenorphine with naloxone. And this is a newer formulation called Zubsolv. This is a generic that they have actually put a brand name on, slightly different formulation, but it all works the same. Brand name Suboxone, generic Suboxone, buprenorphine with naloxone, or Zubsolv, all the same medications designed to stop cravings in people who are on it, so they'll stop the deterioration and the life-ending effects that occur from injecting huge amounts of opiates that people with the disease of addiction use to get high on. And this is the relative equivalence between Suboxone, film, same doses, and this branded generic called Zubsolv. Now, what we're going to talk about in another episode is how we use this medication, how we get people off of the medication, and a very common question, how long do we keep people on the medication?